Coming to question 43 of previous year NEET PG question series. This is a neuro question from 2023. So what's the most likely diagnosis? A 56 years male patient presents with seizures. He had one vague history of seizures 2 days back, vague history of fever actually. His history elicited from attenders reveals behavior abnormalities for the past 2 days. CSF is planned to ruled out meningoencephalitis. MRI brain shows hyperintensities in both temporal lobes. What is the most likely diagnosis? This is also one-liner type of question. We'll just discuss some basics. What is meningitis? It's inflammation of the brain tissue, brain covering. There is a triad: fever, headache, neck stiffness. This neck stiffness is called as meningism. So there are some clinical signs to rule out meningism. So one is Kernick sign. Kernick sign is if you try to extend a fully flexed knee and a hip, if you try to extend the knee, there will be difficulty in extending a flexed knee. You can see some videos which can come as video based question. Difficulty in extending a fully flexed knee and hip. Then we have Brudzinski's sign. Brudzinski's sign is when you flex the neck, there will be flexion of the hip and knee. So this is Brudzinski's sign. So these are signs of meningism or neck stiffness. What is encephalitis? Encephalitis is infection of the brain tissue. When brain tissue is involved, definitely fever can be there. But here mainly there will be altered sensorium or behavioral disturbances is common in encephalitis. Usually meningitis is associated with bacteria or TB. Encephalitis is usually associated with virus because encephalitis means there is affection of the tissues. Sometimes both can occur together. That's called as meningoencephalitis. So the diagnosis of choice is CSF. So in CSF we have a difference between bacterial, viral, parasitic and TB. Parasitic meningitis usually occurs in HIV. Example is cryptococcal meningitis. It occurs when the CD4 count is less than 100. So here we have India ink stain. So another question was discussed on meningitis. So you can refer that. Just a small revision I made here. So here there is a behavioral disturbance, seizures, fever. So this looks most likely an encephalitis. So think of some virus. MRI shows bitemporal intensities. So if the temporal lobe is involved, there is no other diagnosis except herpes simplex. So it is an encephalitis which is herpes simplex encephalitis. Varicella zoster, we can get other clues like definitely for varicella zoster, there should be chicken pox. So either he presents with the chicken pox or he presents with herpes zoster, which is a reactivation of the latent varicella zoster virus. So this history should be there in varicella zoster, and the opacity is not temporal, it is present in the frontal lobes. So that is less likely to be varicella zoster. Toxoplasma meningitis usually occurs in HIV infected people. Then here what finding we get is there can be some problems in CSF. There can be hydrocephalus and we have ring-like opacities. There are only few diseases which cause ring-like opacities in MRI. So it is abscess, tuberculoma, toxoplasmosis, cryptosporidiosis, neurocysticercosis, not neurocysticercosis. So again, some clues can help us pick up. Abscess is usually single. Tuberculoma is also usually single, but definitely history of TB will be elicited. Toxoplasma usually occurs in HIV infected people. Neurocysticercosis, there will be a history of pork intake, etc. And neurocysticercosis is multiple, it is not single. Okay. Plus, there are some specific features about the ring shape opacity. One will be a closed ring, one will be an open ring. I am not discussing that here. So TB or toxoplasma both will have a ring shaped opacity. So it is not the feature here. So herpes simplex is the answer. It's a straightaway question.